Hello, everybody. My name is Tanvi Madugonde, and today I will be discussing how the negative stigmatization surrounding women's health contributes to period poverty. Specifically, how the limited discussion of period poverty as an issue only exacerbates the problem. We will discuss the factors associated with the withheld discussion, why being able to openly talk about menstrual health is so important, and how we can work to end these stigmas and create a truly inclusive menstruation nation. About me. I'm from Scottsdale, Arizona, and I attend Basic Scottsdale High School where I'm a rising junior. I'm a captain on my school speech and debate team, and I'm also currently a state champion in my event. I'm a youth board director in the Phoenix Lions Club nonprofit where I organize community service projects. I'm a member of GUIDUS, where I've written and published 2 research abstracts in 2 consecutive years at the Miracore High School Research Conference. I'm currently the co-president of our school's Red Cross branch, where we work to organize comfort kit packing drives, blood drives, as well as establish other branches throughout Arizona. I want to continue to give back to my community by following a healthcare career path in college, where I want to learn more about molecular biology and neuroscience. Now for an overview of today's topic. Let's start by addressing what is period poverty. The Journal of Global Health Reports defines period poverty as a lack of access to menstrual products, hygiene facilities, waste management, and education, affecting many women globally. On top of an already general lack of hygiene products for women, many countries have preconceived stigmas and judgments about women's health engraved into their culture. The journal further explains that the stigma certain countries hold against menstrual health not only fails to provide adequate products for their citizens, but also forces the public to keep quiet about the conversation altogether. Too many nations consider women's health too dirty and unclean for discussion. Now, let's examine the data that represents how this lack of period talk has affected women globally, analyze the situation that this information puts women in, and explore some solutions to counter this imbalance. With over 500 million women across the globe suffering from a lack of hygienic products and over 300 million women menstruating every day, it's clear that the scale of this issue demands further inquiry. That is 500 million women without access to proper sanitary menstrual tools, health education, or even a stigma-free environment. These factors inhibit proper hygienic maintenance of a woman's menstrual health and often lead to high rates of mortality. A report from WaterAid states that illnesses related to a lack of water, basic sanitation, and hygiene were responsible for the deaths of almost 800,000 women around the world in just 1 year. Specific infections typically contracted as an outcome of an unhealthy menstruation management include dermatitis, urinary tract infections, and genital tract infection, all leading to increased susceptibility for cervical cancer. Now, what do these numbers actually have to do and relate with the lack of women's health discussion in period poor countries? To answer this question, let's examine the demographic transition model. This model predicts population trends based on birth and death rates in a population. The model is split into 4 states: pre-industrial, transitional, industrial, and post-industrial. Because we are primarily focusing on how period poverty due to a lack of education and information affects mortality rates, we will be focusing on the death rate in blue. Because we tend to see this trend in underdeveloped nations, we will focus on the first 2 stages, pre-industrial and transitional. In the pre-industrial state, we see a high death rate due to harsh living conditions, such as limited water access, a high lack of sanitation, and a lack of proper education for females. Pre-industrial nations include Egypt, Mozambique, and Bolivia. Now let's compare this with stage 2, the transitional state. Here we see a decline in the death rate. This is due to increased access to hygienic stations, a safer water supply, and most importantly, increased education with females about their reproductive and menstrual health. Transitional nations include Albania, Belarus, and Bosnia. So what does this mean? As proven by the demographic transition model, increasing period education about menstrual health leads to an overall lower mortality rate for the entire population. However, we must also acknowledge that industrialization isn't the only barrier inhibiting the menstrual health conversation. Another incredibly big factor is traditional cultural values that have been placed on within different communities. For example, in Nepal, menstrual huts are ingrained into Nepali culture. Whenever the women of the village begin their period, they are forced to stay inside one of these poorly maintained huts, outcasting them from their family and limiting their access to food, water, and warmth. An article by NPR explains that several women are killed every year in Nepal because of this traditional practice, just because menstruation was believed to be unclean. While sleeping in the huts, women are at risk of snake bites, freezing temperatures, and suffocation because of a lack of ventilation. Other developing nations, such as India, have instituted similar practices. Rural India can be particularly traditional in these practices, creating separate exclusionary rooms for menstruating women in the house. Now that we have quantified the impacts that a lack of education has had on period poverty, we can conclude that this inhibited discussion forces many women into unhealthy seclusion. So, what are possible solutions to stopping this issue or making others more aware of it? One place to start would be activism, finding local organizations or efforts to join that specialize in bringing awareness to these issues. One very prominent organization in my community is Bloom 365. Bloom works to bring awareness to these issues through tabling events, donations, and packing drives. Just a few months ago, the Bloom branch at my school hosted a period kit packing drive, where hundreds of period kits were packaged for women in need. Organizations like Bloom are effective, but there will always be room for more volunteers. So, becoming active would not only bring awareness to these issues, but make active change possible. Another incredibly helpful way to get involved is through donations. By donating to nonprofit organizations such as UNICEF, Red Cross, and others, your donations are directly spent on feminine hygiene products for women in need across the globe. Finally, taking the initiative to go out and learn more about these issues yourself is a great way to stop inhibiting this period talk conversation. When I was researching this topic, I not only found a myriad of sources to learn more about the issue, but also places in the media that highlighted their significance. The Bollywood film Padman, for example, follows the life of an Indian man who set out to make an affordable, hygienic, and safe sanitary pad for women in India. Documentary-style films in the media like this are a great way of easing yourself into the discussion and establishing a grounds for learning more. Thank you so much to everybody watching this presentation. Here are my references. I would like to thank the Global Health Leaders Conference for giving me the opportunity to learn more about global health through instructive seminars. Thank you also to the Bloom 365 Club at Basis Scottsdale for giving me the opportunity to help with their period kit packing events, as well as help me learn more about issues like this. And thank you to my mother for sitting me down to teach me about this issue through personal anecdotes and her own stories. Here's my contact information. Feel free to reach out with any questions. Thank you so much.